When you have a patient with a suspected neonatal infection, it is imperative to get a quick sample of cerebrospinal fluid for diagnosis. While the lumbar puncture is an established and simple procedure, performing it on a neonate under pressure can be challenging. Yet the puncture must be performed for the sake of the little patient, because the undiagnosed infection can be a life-threatening condition. Let the Injeq IQ-Tip system help you to perform the lumbar puncture optimally. Using its display and sound alarm, the smart Injeq IQ-Tip system tells you when the needle tip reaches the cerebrospinal fluid in the subarachnoid space. To perform a lumbar puncture with the Injeq IQ-Tip system, follow this procedure. First, collect all necessary equipment for the lumbar puncture, including the Injeq IQ-Tip needle, cable, and the analyzer. Then, using aseptic techniques, prepare a sterile table. Connect the Injeq IQ-Tip needle to the cable on your table. Confirm that the stylet is completely inside the needle after connecting the cable. Have an experienced assistant to hold the baby steady in a sitting or lateral recumbent position as appropriate for the patient. Then prepare the patient by disinfecting carefully the puncture area. Prepare the skin and drape the patient for lumbar puncture. Pass the device connector end of the cable to the assistant and ask them to connect the cable to the analyzer. Switch on the Injeq IQ-Tip analyzer, and the device makes a quick automatic self-test. Once the analyzer is ready, you can continue. Next, press OK to start the measurement. Palpate the correct intervertebral space from the baby's lumbar spine. Remove the needle cap carefully, using rotating motion to avoid needle stick injury. Puncture the skin and make sure that the baby stays firmly in the holder's grip. After the skin penetration, confirm that the analyzer is active by checking that the text "Analyzing" is displayed on the analyzer display. Hold the needle in such a way that the stylet does not accidentally fall out during the puncture. Perform the lumbar puncture. Although the audio-visual alarm indicates when the needle tip detects cerebrospinal fluid, never ignore the haptic feedback. When cerebrospinal fluid is detected by the Injeq IQ-Tip analyzer, make sure that you have advanced the bevel of the needle tip fully into the subarachnoid space. Hold the needle steady, avoiding its dislocation from the subarachnoid space, and remove the stylet to check for the outflow of cerebrospinal fluid. The needle may be rotated for the best fluid flow. Handle the removed stylet carefully to avoid contamination or stick injury. If needed, you may reinsert the stylet and continue the puncture. With steady hands and a little guidance from the IQ-Tip system, you can be more confident and focus on what's important: helping the little patient. Right the first time.